This is Impact Healthcare.
Attention. This podcast has been disrupted.
Am I excited for this episode? This is launching the first episode of the Dysrupt Healthcare Podcast. Now, for those of you who are tuning in for the first time or loyal listeners, whatever it might be, the Impact Healthcare Podcast is what we started off with. And what we noticed is the reality of the word impact versus the word disrupt. And I wanted to start this episode and start this season off really with the notion of what's this all going to be about? What is the Dysrupt Healthcare Podcast going to be all about? And quite honestly, the Dysrupt movement. We not only renamed the podcast, we renamed our entire company, our entire branding from impact to disrupt. And the first thing I want you to take from that is that the Y in disrupt is not a misspelling. I'm not a good speller, but that was done very much on purpose because we are tired of everybody focusing in on themselves and profit, I, versus the why we are doing this. So I wanted to lay out a couple of the things that we're going to focus in on the Dysrupt podcast. And it really comes from the notion of what is working. What is working to actually make change, to actually make that disruption? So a couple things. Number one, the listeners want to hear more real life stories about how these strategies, these solutions, the disruption of the current model, how does it actually impact a human life, a real person? Everybody who is listening to my voice right now is a consumer of healthcare. I don't care if you don't have a job, are a CEO or the janitor. You consume healthcare. So understanding how being a different consumer of healthcare, of health benefits, disrupting what you do today is one of the things that most people say, hey, I learned better. It made more sense. It rang the bell when there was an actual live example. Deeper with fewer. I have been an executive platinum on American Airlines for 15 years. So I do probably 100 flights or more every single year. And we went around the country talking to this person, doing this. And what we realized is this disruption of the status quo has less to do with more and a lot to do with deeper. Deeper in the context of working with people, finding people who actually care. And this isn't about standing in front of a room and asking who's unhappy with how much you pay for healthcare and 100 hands go up, because the reality of it is the people who are actually going to help the movement create the change, the early adopters, the first movers, are not the 100, they're the 20 that hear the story of how to get from here to here. And they're the first ones that says, I heard that, I know what it's going to take, and I'm in for it. Count me in. Those are the people that we want to attract to this podcast. Data and case studies. Man, do we get commentary when we threw out a stat, when we dug deep into, hey, show me somebody else who has done this. And so our brand promise in Dysrupt is that every single episode is going to talk about data, is going to show the real life proof, not only the quantitative, the math, the nerd part, but the story behind it on the patient level. This person saves this. They improve their health. They beat cancer. They got a free this, whatever it might be. So data and case study. And I think the biggest thing that we are really going to dedicate more on is continuing to be the platform that educates. You've never once heard, nor will you ever hear us try to sell something on this podcast. You're not going to hear sponsors saying this episode was sponsored by. We might have people that are the main subjects, but this isn't about making money. This isn't about profit. This isn't about thinking about sales. This is thinking about education. And education, the number one thing that we see on why more employers, more employees, more advisors, more people in the ecosystem don't do the things that we talk about on this show is because they don't know about it. They don't feel comfortable about it. And so this is going to be all around spreading the word, being the education source, being the momentum, creating that tsunami of change, and not just change, but of pure, organic, passionate disruption. And I just am so excited to kick off the new season of our podcast, going from impact, moving towards more disruption, but you will continue to hear from other people. You will continue to hear the stories that are creating the change. But the promise that we give you is that this will continue to be organically on the ground, passionately, the thing that we are going to do with every ounce of our soul, every person that works at our company is all around creating the disruption for good. Thank you so much. I look forward to your likes, your clicks, your shares, your comments. Please let us help in any way, shape, or form that we can. If you know somebody that struggled with somebody and you want to understand it more, please let us know. But hold on to your hats because here comes the disruption.
This podcast has been disrupted.